hello everyone. Glad you could make it to tonight's webinar. Tonight we will be talking about knee pain and of course other types of issues as well. But we're focusing on knee pain tonight, and we have Ruth Houde with us, somebody who has been able to, both her and her husband have been able to experience the benefit of using photobiomodulation. And by the way, it's always kind of neat to know where people are coming in from. So I see Cleveland here tonight, and also Alaska, and I'm not sure where else. I can't tell, but thank you if you put in the chat line where you're coming from. So we got Dallas, Oregon, and welcome, Tom. There's two Toms on the line tonight. We'll see if the internet can handle it. Yuli from Colorado. And I'm just saying a general welcome. What I want to do as well is mention that we have once a month we're giving away the Palm Ultimate. And so Jeffrey K has won the light. Anyways, if you're entered in, then once a month we draw, and then we'll get in touch with you. So, Jim, if you'd like to prepare and get ready for playing the first video.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cells super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
Well, as mentioned as well, any questions you might have, please forward your questions to info@sunpowerled.com. It's info@sunpowerled.com. So thank you again for joining us tonight. And we're going to start with our first guest, Ruth Houde. And Ruth, if you would like to get your video going and your audio, you'll have to unmute yourself. There we go. And Ruth, how are you tonight?
I'm very good, thank you.
That's good. That's good. So can you tell me a little bit, first of all, how did you hear about our light technology?
Well, we have a friend that heard you on the radio, and she went down and was so impressed that she bought it. And then when she was telling us about it, and she had scar tissue from surgery that she had, and she used it, and she could not believe how it just helped her so much moving her body after that. So she believed that the scar tissue was taken away, or whatever happened, she was much more comfortable with it. And so we have had difficulties in our lives, and we thought maybe this would help us as well.
Oh, good, good. Well, you got a good friend there because a good friend told you about something. So I'm encouraging all good friends out there that are watching our program tonight to tell their other good friends about about the light technology. And as a good friend, what happened to you?
Well, if we're going to, for myself, we actually went to get it for my husband, who has neuropathy, and he had a surgery done on his knee. And so we went and we got it, and we asked lots of questions and that. And so then we decided to buy it and we brought it home. He had a lot of scar tissue on his knee from the surgery that had taken place, and he also has the neuropathy. So we were told that it would help both. And it has really helped his knee, that he feels such a difference in his knee that he's walking much better now. And also on the neuropathy, his feet were always cold, and when I touched them the other day, they were very warm. So
Isn't
it's
that
starting. Yeah,
isn't
it's so
that
neat.
crazy?
And it's starting the circulation, I believe, in his feet, right?
Mhm.
So he has always been worried about falling because of the neuropathy. And just this week, we have decided to go for walks. And we're starting off gradually. And yeah, so I am really thrilled with the product and what it did for him. So when I was thinking about what it did for him, I have had a Baker cyst. And if anybody knows anything about Baker cysts, they are extremely painful.
Where's that
Extremely.
located?
It's on the back of your knee, on the
For
back of
some
your
that
knee.
don't know, go ahead.
Yeah, and it's like a little
Right?
bulge that comes out. Mine burst, and so very painful. And so I went to an osteopath who really helped me. But when we got this device, I said to my husband, "Do you think this will help my knee?" And so we phoned to find out how long do I keep it on my knee, and for because of the two lights, right? So the first
Yes.
light I kept it on for 3 minutes, and the second light I kept it for 7. And I do it for 5 different areas on my knee. So
Okay,
I would
so
start
just
off.
for to help out people, the one light is the red that you're talking about, and depending on which model, whether it was the Ultimate or the Super Palm, the Ultimate is the 810, and the Super Palm is the 1050 nanometer. I can't remember which one is yours slightly visible,
Ours is
or
a super palm.
your super palm. So it's
Yeah,
a totally invisible. You just see that one little red light in the
yeah,
corner that shows you that it's working. Otherwise, you wouldn't be able to see that at all, know that it's running, other than you could feel the energy coming from it. So go ahead.
yeah,
Yeah. So you used it.
yeah.
So
So
the 3 minutes of the red and 7 minutes of the near infrared around
yes,
on a particular
five
spot.
different 5 different parts of my knee.
Knee. Yeah.
Yeah. And I would say within maybe because I did it every day, 2 times a day, and then I went down to 1 time a day because it was better. And now I only do it if I get a little bit of pain, which I don't get too often. It's like I have my knee back, and I'm just thrilled to death to have my knee back. And so the other day, my other leg was giving me a hard time, my knee and my other leg. And I think it's because when I had the Baker cyst, I would shift my weight when I walk to the other knee. And so when I got the other one back, then it kind of off kiltered me again. And so my other leg hurt me. And I just used that light on my leg that night. And the next morning, I did not have that pain. So I really like this little device that we have.
Well, thank you for sharing your story and how it can actually speed up healing on injured areas. And the other thing is, You mentioned about now, is your husband a diabetic or not?
Yes, he is a diabetic, and he does have
Diabetic.
neuropathy.
Okay, so the issue of blood circulation is huge for diabetics, and to increase that blood flow through the area is very, very important. And that's what this light can do, and that's why also neuropathy can be improved. When I was in Florida, the one woman that was the same age as my mom, 92 years old, she told me that she had neuropathy on her one foot after she had hip surgery, and she says, "So do I use the light on my foot?" I says, "No, well, you tell me a little more." And she said, "Well, I actually had hit when it." I says, "When did it come on, the problem?" And she says, "Well, actually, when I had hip surgery, I had problems." And then I says, "Well, that's likely where that, it could come from a knee, something in your foot. It could come from your hip. It even could come from your spine. So it's really, really important to find out where is the source of the problem. In this case, it was her hip. She treated her hip for a few days, and she got her full feeling back to her foot, and she was so happy. At
Oh, yes.
92, first it was like, how do I use this? Like, what do I do with it? Here, let me just show you. You put and same thing as yourself. As far as treatment since it was the hip, there would be a lot of, I'm just going to move over this way a little bit, but you need a lot of depth. Oh, I know. It's because I'm turning on the light. My head is disappearing. Okay, I was wondering about that. Uh, anyways, the red is the wavelength that can get the blood flow moving, and it also, because it is absorbed a lot by the blood, it's able to carry further than the blood. So that's the red that you're using. And then she used the near infrared a lot more time, because now we're talking the hip. It's got to go much deeper, just like yourself, where you were treating much longer period of time, 7 minutes with the invisible setting, and or near infrared if somebody's out there using the ultimate or the professional, the somewhat dim setting. Um, that's to get the depth, and you'll reach the depth. And so, Ruth, I want to thank you so much for coming on and sharing how this light has been able to help you and your husband. And I'm sure in your hands, you're going to end up helping a lot more people.
I hope to. I've been telling other people about it and trying to convince them that this is what they need to help them get better. I would like to say one more thing is that since my husband's been using the Super Palm, he has got much more confidence in walking. And he never had confidence in walking because he was always worried that his knee would give out or he would fall. But since he's been doing this, the knee feels so much better. And so it also does an emotional thing as well as a physical
Well,
healing.
yeah, and not only that, now that he's able to walk, he's improving other parts of his health as well.
Yes,
So
yes,
it's a domino effect by being able to treat the problem, and then now you can do things you couldn't do before. And that's
yes.
and that's something that we hear again and again, people being able to do things that they've never been done before. And I think there was also a burn that you were able to help as well.
Oh,
Did you want to
yes,
mention?
he had a burn on the top of his foot. Like when he hurt his toe, um, before he would wear shoes around the house all the time, he knocked his toe and he got an infection in it. So when he went to get his nails done, they really kept a close watch on it. And it took 4 to 5 months, because we figured it out, for that toe to heal. And it took a very long time. With the light, we got it and he started working on it immediately. And we've only had the light for, I think, 4 or 5 weeks, and it's healed.
Isn't
And so
that
we,
beautiful? That is beautiful.
and
Well,
if you're diabetic and have neuropathy, that's a very serious thing.
yeah,
That,
the healing time
yeah.
is elongated, and if you can use light to shorten it, the less
Oh,
chance,
yes.
especially when neuropathy, because neuropathy, you don't feel something, so you don't feel that you're injuring your foot or you have an injury on your foot, so you don't even know what's happening, and that's apparently the biggest problem. So Ruth, I thank you so much for coming on. And yeah, I'm going to share the fact that there's some PowerPoint slides I'll mention about neuropathy or diabetes as well. So thank you, Ruth, for coming on. And if I can ask you just to turn off your video and your audio, and that'd be great. I want to show you a case of burns here. Hopefully you can see this okay. So in this case, a person, oh, a person, my granddaughter, 3 years old. She was boiling water, or sorry, my son had boiled the water and she was going to make jello. And she went and this time around, she normally would just stir the jello, but she ended up pulling the bowl towards her and it poured the boiling water, fresh boiling water down her leg. And so she had second and third degree burns. She got some cream and she was in a lot of pain. And they started using my mini canopy, which is the one that's like a foot square. And what happened was that immediately the pain stopped on the first day. And here's day one where the healing is starting to show. Day two, day four, day six, you see the whole area already scabbed up. And by day eight, all the scabs had fallen off, and there was now a full layer of skin over the whole area in 8 days. This is extremely fast healing, and there's research to show why this is possible. And the neat part was about a month in, you could barely tell that there was there was just a little discoloration. And at 2 years, there was no scarring showing. Here's another case of scarring on or burns on a hand, and how it nicely cleaned up very quickly. This is a baby's hand or young kid's hand, and you can see that in 5 weeks, the skin tissue is all the way it's supposed to be. Beautiful. It just helps so much in the healing process. I ended up going to Haiti in 2010, and one thing that I encountered down there, friend was able to get me in there with my light technology. Now this is a slightly different technology than what I'm using now, based on a different light source. And but one of the things we ran into is a lot of burns, and the reason why they had the burns is because many of the homes there, they have propane stoves. Their houses are run on propane, and when the earthquake happened, it shook that shook so severely that the propane stove came away from the wall, snapped the pipe, and then laid propane down on the floor because propane is heavy, and ignited because of the pilot light. And so a lot of women with bad burns on their legs, lower extremities. And we were able to immediately, upon using the light, stop the pain. We had all sorts of injuries of different kinds down there, but again, light was able to usually turn off pain very quickly. One interesting case that was down there, that a boy had, I was invited by one of the doctors in one, they had a whole bunch of tents beside the hospital, because the hospital it had cracked severely, and they were concerned that another tremor would come along and it would collapse. So they had everything out in the tents, and the doctor asked me to do the rounds with him. Once he saw the first patient being treated, I said, this light technology can help. And he said, well, he said, can you show me? And I said, sure. So then he calls up the doctor, another doctor, and they bring a guy over that had a bad fall from the earthquake, and he was limping really bad because of his back. He was in so much pain, and so we shone the light on his back, and about 20 minutes later, the same fellow in his crutches was going like nothing had happened with his back and his leg still on the crutches. And the doctor said, just start treating everybody around here. So I had a individual, a young boy that had fallen, and the doctor said, took me on his rounds, and he says, can you treat this boy? He's got a broken foot. And yeah, he was a younger boy, and he was crying and a lot of pain, according to the parents. And so I did treat the boy, set him up with the light technology. And about an hour later, we came back around with the doctor, and the doctor said, the boy was just there, just kind of not crying or anything. And he was talking to the parents, and he turned back to me and he said, and he's shaking his head, and I thought, oh no, something went wrong. I said, what went wrong? He says, no, I can't believe this. He says, I've never seen this before. He says, obviously he was a senior orthopedic surgeon, and he says, I've never seen this before. I saw the x-rays, and the boy has a broken foot, and we had nothing to give him for pain medication. And he said, this boy does not have any pain anymore, and I've never seen this before, where somebody can have a broken foot or broken anything and not have pain. So pretty neat. There's reasons why I'm working with Dr. Praveen Irani from University of Buffalo, and it's according to TGF beta 1, there's a reason why it speeds up healing of burns and wounds. I will say that I've got a picture coming up that looks a couple of pictures that look pretty gruesome. So if you're kind of shy on that kind of stuff, just look to the side. So this is a picture of a fellow who swung a pickaxe, and I know some of you out there have seen these pictures, but there's a lot of new people on the line tonight watching, and so this is their first experience probably with this. But this young man, 19 years old, swung a pickaxe, and it was sharp, and it went through the dirt easier than he thought, and it cut right through his front tendon. And they sewed it together, the tendon, and just above his ankle, and then it came apart a few days later, so they had to redo a second surgery. This is the second surgery. So a lot of trauma. And you can see in 2 weeks how it looks pretty good with the stitches in there. And 3 weeks post-treatment, the healing is phenomenal. Now, the big thing here is they said that he probably would not be able to walk for 6 to 9 months. And the atrophy starts setting in on the muscles. And that's not the case if you're going to do photobiomodulation. So look at the range of motion he has on his leg right now. Now he has some up and down, but all the swelling that has gone down for him to be able to do this. I mean, there's still some tissue there that is not moving right, but much, much better. And in 4 weeks, he's walking. There's his full gait isn't there yet, but for him to walk in 4 weeks as opposed to 6 to 9 months, he's not going to have lost as much of his muscle through atrophy. This is a diabetic foot ulcer, and you can see on the left-hand side, they had scheduled this for surgery within a week. And what happened was they got um, the daughter or the son got the light into the hospital, and within 1 week they ended up canceling the surgery to remove her foot. And in 2 months, you can see the amount of healing that took place. And I wished I had a 4 month picture, but 4 months it was totally healed. And this is a diabetic foot ulcer. So it really helps improve the blood flow and the lymphatic drainage to clean out the area. Here's a case of open heart surgery where you can see the cut line, and at four weeks, just a hair over 4 weeks, it's healed up so nicely without the scarring that you might see if you didn't have PBM. Interesting thing was he treated his arm every day, and what he's done is he's placed his forearm against his leg. And if you look at his forearm, I know the colors aren't just because of the angle, but you can see how smooth the healing has taken place in 4 weeks along his arm, and his leg doesn't look as good. He treated his arm daily, but he only treated his leg once a week. He thought he'd try that. And you can see how it's still puckered, the wound. There's still not full healing taking place there. And so the big difference between treating once a week and once a day. We've been able to help with strokes. So one of my friends, so the canopy version, one of my friends, helmet version, one of my friends couldn't speak clearly 2 months after his stroke, and we were able to treat him with the light. And after one treatment, that's 1 minute of the red and 3 minutes of the near infrared, he was able to speak clearly. We've also been able to see a number of young people, in this case, a couple of young boys that have had concussions. And this fellow in the middle, he was able to, well, when he came in the first time, he had a patch over his eye. This was day 8, and couldn't, everything was double vision. He was still having concussion symptoms, had to stay in a dark room, no video, and within the one treatment, the next time he came in 2 days later, he didn't need the patch. He said, he came in and he said, everything's pretty good to see now, except, he says, across the far room, I can't quite make that out. And then he did the light treatment and came out, and he said, oh, that's cleared up over there. So he was able to see the room clearly after the outside wall with that 4-minute treatment. We also have a large version, which is a canopy, which is a large area of the body. It's basically 6 of the mini canopies. Okay, so one of the things about our light is that we have a very, very even illumination over the whole area. So we don't have hot spots, and hot spots, or even the fact that there's only little spots of light. So the penetration the light from one does not add to the light to the other. Where what we have is, because the the angle being what we have, it overlaps, and you have a very continuous amount of light. So just to show you the difference between 660 and 810, on the left-hand side, there's a picture, and you can see the 660 going through the cheek. And on the right-hand side, you can actually see the light going not only through the cheek, but also through the gum line. So this is a picture that grabbed off the internet, but basically we are much, much deeper than these pictures because of the power level that we have. But the diagram shows that blue does not penetrate, 450 nanometer blue does not penetrate very deep. When it gets to red, you get far more penetration. And when it comes to near infrared, you get much deeper yet. And when we go to 10, 50 nanometer, you get even deeper light yet. I've got to replace this slide so that I can show that. But basically, this just shows you that as the wavelengths are getting longer, you penetrate much deeper. And obviously, we're much, much deeper than the dermis with the red light because of the power and the area that we have covered. This is more like if you use a laser or something to that effect, or a low power LED device. Also, I want people ask sometimes about lights versus lasers. On the left-hand side and the right-hand side, the left-hand side has an LED from us. Right-hand side is a laser. We calibrated the left-hand side. We really reduced the power level of the LED, and you can see that 3 milliwatts of light power from an LED going through my finger looks identical to the light that's coming from a laser pointer with 3 milliwatts. So, and we were able to just recently, we're hoping that it'll get published soon, is where we went through 1 stake, 2 stakes, and 3 stakes. That's like each stake was 3/4 of an inch, almost so we went through 2 1/4 inches of steak, or 2 1/4 inches of pork, or 2 1/4 inches of chicken, and we're able to see that whether a laser or an LED was used, if they had the same power. In our case, we have 5 optical watts of power or better, and we compared that to a laser, similar laser in power, we got the same light through. So it doesn't really matter whether it's a laser or an LED. But one thing is important, is that an LED is extremely safe to use, whereas a laser could end up damaging the retina if you're not careful, and that's why you have to wear safety glasses. I think I'm going to leave it here at this point. Again, very, very safe. There's no hot spot that'll hit the back of the retina. So I'm going to escape from this now, and we're going to go back, and Jim, I'm going to make you a host, and you can, okay, and you can run our short video then, okay? Okay. PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's a sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy, and then there's a host of different processes that are stimulated because of that light. So you can speed up healing, you can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have 2 different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm series, can help you, please reach out to us and we'll get back to you as soon as we can. All right, so let's just do this. There we go. If you got some questions out there, we'd love to answer them. But I'm gonna first just go quick, just over our products. So this happens to be our helmet device. This is the, so this has the two wavelengths of 660 nanometer there and the 810 nanometer light. You can see that down in there, and this just goes down on top of the head like this and treats, there you go, that's how that works. And so we've just done a study was just completed in West Virginia, and very shortly we believe that the study will be published. It's been already reviewed a couple times, and it's pretty exciting about the fact that they were able to see a significant improvement in opiate addiction. These are people that had opiate addiction, and in your chat there's the article, opiate addiction and depression, and just twice a week treatments with our helmet ended up treating, ended up having people that had a significant improvement in their situation, less cravings, and other things, as far as other beautiful things. So yeah, good question comes in from Shane. Each company seems to have different NM, different frequencies, duty cycles, each with their own studies to support. How do we know which one is the best? Well, I've been at this for 15 years, and there's a, I can tell you that I have developed these devices in North America. We build them in North America, and they're not built in China. And one of the big things is specifications. And specifications are all over the map, as far as there's not anything true about the specifications from China. Matter of fact, I've seen model number 1400W, that may confuse people, 1400 watts, and then later on they say no, we're only using 535 watts, and then you wonder if that's even correct. And then even if it was using 535 watts, LED efficiency is such that it's 25 or 35% depending on the wavelength. So you might only have a quarter of that. So they spew out information based on LEDs that are not correct. What I'm talking about in the specifications that I have in our devices is the true optical power. I've spent a lot of money, thousands, a lot of thousands on LED measurement equipment. One of the devices alone is just a small box about this big But what it allows me to do, it's $6,000, and then you tie that to the other pieces of equipment that are also required of thousands, and then, but anyways, what that allows you to do is measure how much power is at any wavelength that I'm looking at very, very accurately. Some of the podcasts out there, they'll use a light meter, and the light meter is one that measures the sunlight or light inside the room in foot candles and or lumens. And the problem is that these are not accurate measurements when it comes to certain wavelengths. So they're calibrated at one wavelength in, let's say, green is typically used because that's the what our eyes are most sensitive to. And then as far as how much energy is in there in the red, it's way off base. So it comes back to optical power. So how much power do you have over a certain area? So in this case, our palm units have a 3-inch in diameter space, and that whole area is providing illumination. And with the power that we have an optical power density that is very high. So when you're looking at this, you're also seeing a very, very even illumination over the whole area. So there's cheaper devices that you can get on the market that might even look a little more impressive, like you see these lenses on it, okay? And what they'll do is they'll measure the light power right over top of the lens, right over top of the light. But do you see there's a problem here? If I measure the power over top of this particular light, wow, look at that. It's almost as bright as it's almost as much energy as the SunPowerLED Palm. But what about the area over here? It's not getting that at all. Now, when you saw when I did it the other way, you saw that the whole area is all lit up with the same intensity. So that makes a huge difference on when that light goes into the body. It's not spots of light. It's, with our device, we call it the wall of light because it's got a continuous amount of energy over the whole area that allows it to go in like a solid wave of light going in, which helps penetrate the depth and end up with energy penetrating to deep into the body, as in the case of sciatic hip pain, trying to go into the depth. We've been able to see people help with diabetic foot ulcers, which has to go deeper into heel areas or the hip or the shoulder. And now we're being able to show, very shortly, we'll be able to show some studies showing how our light, which actually has more optical power, for those that like to learn about joules, we're providing 25 joules of energy into the brain every second, which is a lot of energy, okay? Let me just, Susan is asking, what can we do for shingles? My friend has shingle pain over his forehead and into his eyelid. Again, light therapy can help with the nerves, and it's something that can be helpful. And Susan, if you want to contact me directly, we can get into more details, but it's possible to help reduce the nerve pain from shingles. Yes. Okay, good question by Shane. Shane is asking, do you have protocols for certain conditions, and when the product is purchased, is there a possibility of overdoing? So yeah, we do have a number of webinars where we talk about how best to use it. Plus, we've got some more information in our manual. Plus, when it comes to certain conditions, we will offer suggestions. And everybody's different. There's so many variables to this, but there are generalities that will help, and we suggest ways of determining what will end up going best. And by the way, just to let you know that I'm not a medical doctor. I absolutely know nothing. Okay, so don't base any decisions that you make on me. But I have worked with a number of doctors, and they love our product, and we've been able to see a number of people being helped by using our product. So I can't diagnose, I can't determine anything, but I can tell you that we've been able to have some great successes. We also have, so we have we have different versions of units. We have the professional, and the professional device has the two wavelengths, the 660 nanometer and the 810. Sorry, I picked up the wrong one here. This has the 660, and this has the 810. And the 810 is something I can visibly see it, and you can too. Okay. And the professional has that, the ultimate has that. The ultimate is like 25% more power than the professional. And then we have our best unit, which is or at least it has the wavelength that has the same, all of these have similar power, or at least the ultimate and the super palm have similar power, but we have the 10 on the super palm, we have the 1050 nanometer, which when I turn it on is totally invisible. But I do have one little red indicator there that says it's working, but you can actually see through the camera, you can see the purpley looking LEDs, and that is what you can't see, but it's going very deep with that wavelength. So that's where the Super Palm has a little bit more advantage, can make things happen a little bit faster. Okay, Tom is asking, okay, what is the best way to use the palm on a large area of the let's say the back? Use the red for 1 to 2 minutes in 6 areas, and then go back over this deep settings for 3 to 4 minutes, or treat one area at a time at 660 and then moving 810. It really doesn't matter that much as to how, it's just that you're going to be spending more time over the whole area. So the couple minutes of the red for deeper areas, the couple minutes of the red, and longer time for the near infrared when you're talking about deeper areas. I would say about 75% of your time should be with the longer wavelength, which is either the 660 or the 810. Our palm and our mini canopy do have the possibility on special order to have the 1050 nanometer as well built in. So we have then the 660 and the 1050 nanometer available on either the mini canopy. And the one thing about the mini canopy, Tom, is that you are looking at an area as well. For other people that are asking, there's 15 times the area of a palm light with one of these. So obviously you can end up treating much faster because you can treat the whole area. Same with the mini, with the helmet. We're talking 1 minute of the red and 3 minutes of the near infrared. You can do the same thing with the palm light, but you'd have to try and divide your skull in 10 areas, 2 areas here, 2 areas there, 2 areas there, 2 areas back here, and then another 2 on top. You get 10 areas, you divide it up. And but now you're into, if you were to treat the whole brain, of 40-minute treatment, so much longer period of time. There's also, we do have the possibility of somebody wants to get the additional option when they get their units. This just snaps into the front of the unit and now allows you to put the light into your mouth in specific areas. So if I turn this on right now, you can see the light coming right out of the tip of this unit. And so you can put it in the back of the mouth and treat that area, okay? Or treat a specific gum, or that is our intraoral probe. So Beth is speaking to a woman who has TBI. She may contact you, but wondering if the light can be used with a, not familiar what kind of pump that is. But generally, it doesn't matter. Wavelengths of light do not interfere with electronics as far as pacemakers. You're okay to use it when they're talking of screws and plates that are put into the body. Artificial joints, light can have no problem being used in conjunction with some of those devices that are implanted in the body. Susan asked, would the helmet assist with the neuropathy? I guess it depends if the neuropathy is actually based in something in the brain area. If there's a problem there, that's orchestrating the problem. But otherwise, it may be a problem anywhere along the nerve conduction too. So if you're talking the bottom of the foot, it could be a problem in the ankle. It could be a problem in the knee. Could be a problem in the hip where the nerves pass through the hip. Could be a problem in the spine then, where the light penetrates into where the nerves penetrate into the spine. So all those areas would need to be looked at, but it would be depending on where is the problem originating from. So I want to thank everybody for joining us today. And the winner in April was Jeffrey K. From I think if I remember correctly, Massachusetts. So and please make sure you drop us a line or even chat. We'll leave the chat line open for a few minutes. And I just want to thank everybody for joining us tonight. And if there's a particular program you'd like us to cover, we gladly do that. Also, if any suggestions, any suggestions on other types of ailments, we can do the research. Also, there's a lot of research on our website, SunPowerLED. Go into the research area, and you'll see you can click on a topic and then type it in, and you will find the area there's 7,700 research articles there under the PBM database. Okay. Well, thank you again for joining us, and you'll have to wait till June to find out if you just happen to be one of the winners of one of the devices, so the Palm Ultimate. All the best, and please tell your friends about our webinar. We'd love to have more people join on with us, and we thank you for how many different countries are now represented by watching our webinar. So all the best, and bye for now.